I'm bloody J, I'm an addict. Money, lean, weed, yes, I got the habit.
It is really common for people to become addicted to nasal sprays, so I'm going to show you how to get off them. If your nasal spray is a decongestant that contains xylometazolene, oxymetazoline, pseudoephedrine, phenylephrine, or anything like that, then this video is for you. These medicines can be really useful for reducing congestion because they constrict the blood vessels in your nasal passageways, which then stops your nose from running. However, when used for more than a few days, when the medication wears off and your blood vessels dilate, you get rebound congestion, which means that blood flow just floods into your nasal passageways, and then your nose becomes so much more stuffy and blocked and congested than it was before you even tried the medicine. There are several ways that you can come off these medications, and some of them are more pleasant than others. So one of the really horrible ways to do it is just to go cold turkey and stop the medication. It's going to be absolute nightmare for weeks, months, and some people even report it being horrible for about a year. But in the long term, it's probably worth it. The second way, which some people may find easier, is to stop it in one nostril at a time. So you stop it completely in this one, you go cold turkey, but you keep using it in your other nostril. And then as soon as this one has fully recovered, then you stop it in this one, and at least that way you're always able to breathe through one of your nostrils at a time. The third way, which is probably a little bit easier, is that if you're addicted to the sprays and you're using them every 2 hours, try and increase the time between doses to 2.5 hours or 3 hours for a few days or for a week, and then gradually increase the time between the doses over a longer period of time. If you have any concerns, please go and see a doctor, because we can prescribe things like nasal steroids, which means that we can help you reduce the inflammation within your nasal passageways and hopefully make it easier to come off the nasal decongestants. In some cases, we might recommend using oral decongestants, and in others, we may recommend nasal saline rinses or even saline sprays to try and help you with the weaning process. Let me know how you get on. Let me know if you've tried any of these in the past and whether or not they've worked, and send this to someone who's addicted to nasal sprays.